Hi friends, I know everyone is just dying to learn more about circumcision. So, what is a circumcision? A circumcision is the removal of part or all of the foreskin of the penis. This is a surgical procedure that is performed by the provider during the first few days of life, or later if the baby is preterm or ill. There are different reasons why a circumcision will be done. One benefit listed by the World Health Organization is that circumcision helps with hygiene of the penis and helps prevent other health issues like contracting STIs, UTIs, and certain types of cancer. Other reasons to circumcise an infant include religious or social reasons. Much controversy surrounds whether or not babies should be circumcised, as some people feel it is unnatural and unnecessary, and that circumcising the baby subjects it to pain and other complications related to the procedure. So, whose decision is it? Ultimately, it is up to the parents to decide whether or not the infant should be circumcised. Our role as nurses is to help the parents think about whether or not they want to have their child circumcised ahead of time during the prenatal period. This prevents the parents from having to make a game time decision once the baby is born. As nurses, we should provide unbiased information about circumcision prior to the baby being born so that parents can make an informed decision ahead of time. So, what happens when a baby gets circumcised? The first thing that we should be aware of is that we will never circumcise a baby immediately after birth. This is because we don't want to cause the baby any cold stress and because the baby's clotting factors decrease immediately after birth. But these clotting factors do return to pre-birth levels about a week after birth. Circumcision typically takes place in the hospital before discharge, so by this point, clotting factors are not quite as low as they were right after birth. In preparation for the procedure, we will withhold feedings 2 to 3 hours prior to surgery in an effort to prevent vomiting or aspiration. Keep in mind, though, that some hospitals will actually allow breastfeeding up until the procedure. When the provider is ready, the infant will be secured onto a plastic form and draped for warmth, as well as to create a sterile field. The penis is cleaned and sterilized using soap, water, and then a solution such as povidone iodine. Of course, before the procedure begins, the infant will be given some type of anesthetic for pain. The technique to be used for the procedure depends in large part on the provider's training and preference. I have included pictures of the two types of clamps that are often used, the Gomco and the Mogen, as well as the Plastibell device. The clamp techniques help minimize blood loss, and the Plastibell device is interesting because it requires placing the device inside the foreskin, securing it in place with a suture, then cutting the excess skin away. The device stays in place and eventually falls off as the penis heals. The book mentions 4 methods of pharmacological pain management. They are a ring block, dorsal penile nerve block, topical analgesics such as Emla cream mixed with lidocaine, and oral sucralose. The Cochrane Group states that dorsal penile nerve blocks are the most effective intervention at decreasing circumcision pain. It is important to remember that once any of these medications are administered, some time must be given before starting the procedure to allow the medication to work. After the procedure, 10 to 15 milligrams per kilogram of acetaminophen may be given every 4 to 6 hours as needed. Be sure not to exceed the max dose, which is 30 to 45 milligrams per kilogram per day. Some things to educate parents on as far as post-op care. They should monitor for bleeding, and if bleeding occurs, apply gentle pressure to the area. Remind parents that as the penis heals, they may notice some yellow discharge around the area. This is okay. While in the hospital, we will monitor the infant's eyes and nose. Remember that with each diaper change, the bandage should also be changed. The penis should only be cleaned with warm water after surgery, and remember to apply a little petroleum jelly or antibiotic ointment to the area to keep it from sticking to the gauze. Teach parents to monitor for signs of infection like redness or swelling. Also, parents are going to hate that their child is in pain, but they should monitor their child for this. Vocalization or crying is the most common sign of pain. Keep in mind that there are different pain scales that we can use to evaluate pain in neonates. Examples of these include the NIPS, PIP, and CRIES scale. Lastly, while the infant is in our care at the hospital, we will want to monitor his vital signs for any physiological responses to pain. Finally, we will want to encourage parents to help manage baby's pain in non-pharmacological ways. These include swaddling the baby, allowing the baby to suck on a passy or to breastfeed, giving the baby a little more oral glucose, or sharing some skin-to-skin contact with mom or dad.